Good afternoon. I'm Dr. Elligan. I'm a clinical psychologist in Chicago, Illinois, and this is Everyday Psychology. Today we're going to be speaking about anxiety. What is anxiety? In past episodes we've spoken about stress, and I mentioned in the past that stress is something that's past-oriented. Today, with respect to anxiety, we're talking about things that are all future-oriented, things that haven't happened but are consuming a lot of thought for the individual. So, anxiety is when an individual is feeling a great deal of fear, worry, apprehension, or overwhelming, intense emotions about something that can be very intense at the time or mild and chronic, meaning it's not completely overwhelming, but they can't stop thinking about it and it lasts for a long time. That's what we mean by anxiety. And the key thing with anxiety is that it's future-oriented. So in psychology, there are quite a few disorders that fall into the category of anxiety disorders, and we're going to review a couple of them. The first one is panic disorder. So panic disorder is when a person has overwhelming fear associated with panic attacks. So their heart is racing, their palms are sweating, they may feel like they're losing their breath, like they're drowning while breathing. They can't get enough air in. Oftentimes people will rush to the hospital complaining of a heart attack, and upon medical examination, the person in the ER says, you're not having any medical problems, you're not having a heart attack. You may want to see someone in behavioral health because they may be experiencing a panic attack. So panic attack that happens repeatedly can lead to a panic disorder. Oftentimes, when people experience these repeated panic attacks, they can develop a panic disorder with a type of phobia that we refer to as agoraphobia. Agoraphobia is a fear of being in a place where you can't escape. So many people who develop panic disorder will confine themselves in their house after an episode of a panic attack because they don't know when they're going to have another attack. It's like being struck by lightning. They don't know when it's going to happen again, and as a result, they want to stay in a safe place. That safe place oftentimes is their home. So they may not leave their home for extended periods of time. People can also have panic disorder without agoraphobia, but a common associated disorder with panic disorder is agoraphobia. And obviously, if you don't have agoraphobia, you have panic attacks, and it doesn't interfere with you leaving a safe haven or a safe place. Another type of anxiety disorder, which is very similar to a panic attack, is a phobia, where a person has an overwhelming emotional reaction to a situation, a person, or a scenario that basically leads to a panic attack. The distinction between a panic attack and a phobia is with a panic attack, it comes out of the blue. The person doesn't know why their heart is racing and they're sweating and they feel like they're drowning and they feel like they have this impending doom. Whereas with a phobia, you know why. It's because you don't want to get on an airplane, or you're fearful of water, or you're fearful of driving over a bridge. But the symptoms are the same. And the distinction is knowing what's causing it versus not knowing what's causing it. If it's unknown, we usually refer to it as a panic attack. If it's known, we refer to it as a phobia. The symptoms are the same, though. Another type of anxiety disorder is generalized anxiety disorder, GAD. And generalized anxiety disorder is a person who is basically a chronic worrier. They worry about everything, but to a milder degree than the person who's having the panic attack or the phobic reaction. Their emotions aren't as tense, however, they're a lot more chronic. They last a long time. So every day, day in and day out, the person is feeling this level of anxiety that makes them a little uncomfortable, keeps them on edge, maybe distraction for them, may make it difficult to concentrate or maintain focus in the workplace. And oftentimes, when you ask them what's making them anxious, they have difficulty answering that question. And it could be because there are many things, or they don't have the insight into how these things that are taking place in their life are valid reasons for them to be anxious. They may think that these are just everyday stressors that they should be able to manage and ignore how these things are actually affecting them, but the body is revealing to them that something is wrong. So that's generalized anxiety disorder. Another type of anxiety disorder is obsessive compulsive disorder, OCD, where a person has recurrent thoughts about something. We call those obsessions, and the only way they can get rid of those recurrent thoughts are through behaviors, which we refer to as compulsions. So an example of an obsessive compulsive type disorder may be a person who is very but anxious about getting germs on their hand when they open the doorknob, open a door. So if they touch a doorknob, they may become obsessed with these germs that were on the doorknob, getting on their hand, crawling up their arm, and infecting them, leading to a life-ending injury, like pneumonia or something like that. So to manage those thoughts, which we refer to as obsessions, they have a compulsion, and the compulsion usually is very specific and very magical. So they may have a solution for getting rid of that obsession. That solution may include, for example, washing their hands with water that's 72.5 degrees with 3 different types of soap. One brand of soap for 30 seconds, another brand of soap for 24 seconds, another brand of soap for 10 seconds. And if they can go through that sequence, they can actually get rid of the obsession. And that sequence of behaviors is what we refer to as the compulsion. If they can't go through that sequence, they can't shake the obsession, and it's difficult for them to move on or go on with whatever it is they're trying to accomplish in that day. So that's what we refer to as obsessive compulsive disorder. And then another type of anxiety disorder is actually a stress-related disorder, but we oftentimes categorize it as an anxiety disorder. It's post-traumatic stress disorder, PTSD. When a person has something traumatic happen to them, oftentimes they respond by having intrusive memories about that event, nightmares about that event, a startle response about that event, and it makes it difficult for them to move on without reliving the experience of the traumatic event. So an example could be, actually one of the more common examples here in America are auto accidents. So after a tragic auto accident, people may have difficulty getting back into a car and driving. They may have chronic nightmares about the auto accident. While at work, they may have intrusive memories about the auto accident. Despite the fact that they're trying to think about other things, they continue to think about this tragic accident. So that's post-traumatic stress disorder. It manifests in a variety of ways. One of the more common ways here in the U.S. is through auto accidents, because people have accidents on a daily basis. So in review, anxiety disorder, and before we get to anxiety disorder, anxiety in and of itself is when a person is feeling fear, worry, or apprehension that's overwhelming, and they're having a difficult time dealing with it. There are a variety of different types of disorders that fall into that category. We spoke about panic disorder with and without agoraphobia. We spoke about phobias, and people can have a phobic reaction to just about anything. Generalized anxiety disorder, or GAD, where a person has mild chronic anxiety. Obsessive compulsive disorder, or OCD, where a person has these chronic obsessions and compulsions that help them manage those obsessions. And post-traumatic stress disorder, which is a reaction to some stressful event that has happened, and the person can't shake those thoughts, and those thoughts continue to interfere with their functioning. Those thoughts may manifest in intrusive memories or dreams, and the body stays on edge as a result of it. I'm Dr. Elligan, and this is Everyday Psychology.